Thank you very much and good afternoon. Today we are deeply saddened by the death of a patient in Dallas. Despite maximal interventions, we learned today that he passed away. And our thoughts go out to his family, friends. He is a face that we associate now with Ebola. Since the start of the epidemic, 3,742 patients in West Africa have been documented to have died from the disease. We don't have their faces as prominently in front of us, and we know that even more people have been affected. So we think about this and we remember what a deadly enemy Ebola is and how important it is that we take every step possible to both protect Americans and stop the outbreak at its source in Africa. One of the things we do to protect Americans here in the United States is to improve our preparedness in our healthcare system. The three key steps are: first, thinking of the possibility of Ebola and identifying who may have the disease so that, second, they can be rapidly tested, and third, effectively isolated. That's crucial for our response. And identification, diagnosis, and safe care of anyone who may have Ebola needs to be top of mind right now for healthcare providers throughout the country. At CDC, we do quite a bit to support healthcare workers in addressing and assessing patients. We've provided detailed information that should be available to every frontline healthcare worker about how to address a patient who may have Ebola. Anyone with fever should be asked if they have been in West Africa, specifically Guinea, Sierra Leone, and Liberia, in the past 21 days, and if so, rapidly isolated, fully assessed, and if appropriate, tested for Ebola. We provide something called Health Alert Networks, which reach hundreds of thousands of healthcare workers. We do webinars. We reach out to professional associations, hospitals, emergency department associations, medical associations, and many others, so that we can ensure that the available information is up to date and useful. Right now, the bottom line of what we're talking about today is that we're stepping up protection for people coming into this country and for Americans related to travel. We will continuously look at ways that we can increase the safety of Americans, and we do that at many different levels. We do that in Dallas, where officials there are working intensively to monitor every person who might have had contact with the index patient to ensure that if they do develop fever, they're immediately isolated and the chain of transmission can be broken. We do that in our healthcare system with the kind of outreach I've described, so that patients will be rapidly diagnosed and, if found to have Ebola, rapidly and effectively isolated. We do that at the source, understanding that until this outbreak is over in West Africa, whatever we do can't get the risk to zero here in the interconnected world that we live in today. And we do that through entry and travel programs, including the efforts that we undertake in West Africa, and some that will be described in more detail later in this briefing. I think before turning it over to Deputy Secretary Alejandro Mayorkas from the Department of Homeland Security, I would like to emphasize the basic principles we use when looking at interventions. We continuously evaluate ways to better protect Americans. Protecting Americans is our number one priority. Second, we make sure that whatever we do is something that works, that we evaluate, and that we can think of ways to continuously improve. Third, we recognize that whatever we do, until the outbreak is over in West Africa, we can't get the risk to zero in this country. That's why we continue to surge the CDC response in West Africa and the whole of government U.S. response in West Africa, and in fact the international response, where we're seeing hundreds of healthcare workers, hundreds of millions of dollars, and intensive effort deployed in the three countries most heavily affected. And finally, as we say in healthcare, above all, do no harm. We have to ensure that whatever we do doesn't unintentionally increase the risk that we will be at risk. Just to remind us of what happened a decade ago in the SARS outbreak. The SARS outbreak cost the world more than $40 billion, but it wasn't to control the outbreak. Those were costs from unnecessary and ineffective travel restrictions and trade changes that could have been avoided. Well, what we want to do is ensure that we don't undermine our ability to stop the outbreak at its source and unintentionally increase our risk here. So to outline some of the new measures being taken and review some of the measures that are already taken, I'll turn it over now to Deputy Secretary Mayorkas.